Okay, let's get started with part 3 of client acquisition. Part 3 is called Lunch and Learn, and we're throwing this in here. Study club is a really important part of this, and that's on a much bigger scale, and we'll get to that later. But a lunch and learn bonds your accounts to you, and done the right way, you can get word of mouth referrals with a good presentation. Even better, it makes you the professional, it makes you the guy with all the experience. You are the expert on whatever you're talking about. And in a lunch and learn, you could have the doctor and most or all of the staff. You might have 3 or 4 doctors, however many is in that office or maybe in that building. So these are really valuable when it comes to marketing and when it comes to bonding your clients to you and to your lab. So on a lunch and learn, the question is, what is it? And most of you know, but I get asked, what is it? So I'll answer that. It's education. And education really is the hot button these days, and that's the thing that will get you accounts when nothing else will, is offering education and CE credits. You can't offer that here, CE credit, but you can offer great education, something that will save that office time and money, and something that makes you look like the expert. So we're going to talk about what are the best things to do for a lunch and learn, and you know, the number one question after what is it that I get asked is, who buys lunch? So, you know, really, who cares? It's such a great situation that you're being put into that you could buy lunch. The truth is, I've done a few of these and I've never bought lunch. The office has always said, okay, we'll have lunch there, we're going to order it from here, what kind of sandwich do you want, or what kind of pizza do you like, or you know, wherever they're ordering from, and it's no big deal either way. If you're buying the lunch, great. I would suggest that you just get pizza. If you start doing specialty lunches or something, it can get expensive, and I'm trying to do a lot of this, most all of this marketing without big money expenditures, because you can do marketing that is more effective than any other marketing, and it doesn't cost anything but your time, and your time being valuable, that's why we're funneling it down to the most effective marketing you can do. This is one of those things. So, who buys lunch? You can if you want. Keep it cheap, keep it simple, because they're there for the education. They're, you know, you don't have to impress them with lunch. And if they offer to buy lunch, great, let them, because you are giving them the benefit here. The other question, and this is a good one, is what shall I teach? What do I know about? What's important to bring into that office? And so you can ask the office, would you like me to teach? And just make sure that you're prepared with this, but I'm not going to teach this in this module, because almost for every account that we have, they all do it differently at some stage. They insist that that's the way to do it, and we got no problem with that. All on 4 is something we specialize in, and it's a higher profit item, and however they want to do it. But you can go in and teach either the system that you know, or what to expect when you're doing that, what they should expect, and what role you as a laboratory play in that? Maybe you're there for the chairside conversion and you're there to help take impressions and bite verifications and the implant verification. It just depends on how much you play in that, but use that as a number one possibility. Your all on four or your teeth in a day, whatever you call it in your area. So there's one lunch and learn, and you need to hold these to 30 or 40 minutes. They don't have a long time for lunch. You kind of need to set up, and people kind of start coming out of the woodwork, and you're waiting for this person who's finishing up with the patient, and you're waiting for somebody to finish up with some insurance people she finally got on the phone. So you kind of hurry and wait, and people are eating, and you're trying to teach something of value. So and you have a short time to do it in. And after you've done your first couple, you'll get good at it, and you'll know what to bring, what makes the most sense. Now I have a portable screen, and it's a pretty big screen, but I can walk in and set it down and pop it up, and it opens right up. Then I have a little old projector, and I can hook that right into my old laptop and throw a PowerPoint up on the screen, and it's highly effective. Or I can stand and do what I'm doing here, and usually if I just have a short amount of time, then this is what I'll do. The other thing is a breakfast learn. I've done that a couple of times, and people, before they get going in the morning, or maybe they'll schedule their first patients a half hour later or something, and come in there when everybody's just fresh and getting to work, and do one then. And breakfast is not that expensive. It's an easy thing to do. But do a good job on a couple of these, and you'll get referred, and possibly even to an account that you do not have. And when you come in there as an expert, you will get some work out of that office. And this is excellent marketing. How to take a great custom shade. If you're going to teach it to a bunch of assistants, or maybe the doctor's listening, or maybe he's not, they really pass over this in dental school, mostly because they think the doctor's not interested. I have a son in dental school right now, and they spent 10 minutes talking about doing a custom shade. Moved on, that's all they're ever going to get out of it. So let's go with custom shade just a little bit and make sure that you're going to get what you need when you teach it. Take a master guide in with you, the Vita Master, because it's set up light to dark. It's the easiest way, because a shade, if you're A, B, or C, A is red and B is yellow, C is gray, D is a brown red. You can find the hues in there, but if you're off on light and dark, that's when the tooth looks wrong. If it's too bright or it's too dark, it was a bad shade. Not if the hue is off a little bit, that can match okay. So let's just go in there with that master shade guide. They're expensive. Don't buy it for the office. Just tell them how much they are. You can offer to get it for them, or just tell them where to buy one. About half of my clients have one and use it. The other half don't, for whatever their reasons, slow to change probably. But if I do a shade in my lab, I always use that. And I shouldn't say if, we do 4 to 5 shades a day. And when you walk into my office, I have a color corrected light over a dental chair, and so we seat the patient, lean them back to the right angle, and take that shade. Now I'm going to talk you through this a little bit. You probably are doing this great, and you're probably doing it better than I am. But here's how to teach it. Hold the shade tab up, the whole shade guide, and just show them, maybe have somebody stand up with you, and just take that shade guide across their teeth and start with the darkest colors. And it's obviously, you know, you've got a pretty girl smiling there. Start with the darkest color and move light until you get about to where she is. Pull that one out and hold it up, and you can kind of tell if it's light or dark. And especially the people sitting back further are going to say, oh, that's too light, or that's too dark, or that looks pretty good. If it looks pretty good, flip the tab around so that the incisal edge is up, and put that incisal edge to incisal edge of her 8 or 9, and get it on the same angle. So if she's in a dental chair and laid back, then you've got it on the same angle as her teeth. Standing up, it's on the same angle. Incisal edge to incisal edge. If it looks great, if that's what it looks like, write it down, you're done. That's fabulous. About 80% of the time, that's not perfect. So then I just take out my cell phone. I ask them if it's okay if I just take a close-up picture of this shade. 100% of the time I've been told, sure, no problem. I zoom in a little bit, so widen that lens out, zoom in, and then hold that tab and get close so that everything's in focus, but you're pretty close. Hold steady and take that picture. If it's in between a couple of them, it's always good to have the one tab that's the very closest to the shade. But if it's in between a couple of them, then hold both of them up. Incisal edge to incisal edge, and it really helps if you can read what the shade number is. Like if it's a 1M1, it's great if you can read that on there, then you don't have any question. Hold that up, steady. Sometimes I'll have them reach up and hold their lip up so that I can see their whole tooth. And I'll click that picture. Now, on a full color corrected screen, you're blowing that up in the lab, and it looks great. You can pick out translucence. You can see how far up the translucence goes, what it's shaped like, if there's mamelons in there, what the body color looks like, what the gingival looks like. You've got it all there because you've gone light to dark, you've got a picture of it, and the hue kind of comes secondary, but naturally, now that you've got 1 or 2 tabs up there, you can see really what the hue and what the chroma is. But the main thing is that value. You got light to dark, and I'll teach it like that, and then we'll take turns just doing a couple of shades and saying, take it to here, take it to here. And some, you know, I was, one of the last ones I did, the girl said, what does it matter? It's just in the back. And I'm like, whoa, it matters to me. It matters to the doctor. I think it matters to the patient. And when it's that easy for us, when it's just gonna take 30 seconds, let's get it as close as we can. It might just be a number 19, but let's get it close. So that's a custom shade program. And so we've got a couple here, but this custom shade is something that actually saves you time in the lab, and it's incredible if they're doing that much, and even on posterior teeth, and you have them do the custom shade and get it close, man, it makes your work a lot easier. So this little lunch and learn has turned out to be very valuable. The next thing we want to talk about is communication. So you can do a whole lunch and learn on communication. And these are things, sometimes you could do the whole 40 minutes on teaching them how to take a correct bite. So communication with the lab, I think it includes all of these things. I think it's a bite, and it's the occlusal clearance. Is there enough clearance? It's the margins. Did we capture the margins in the scan or the impression, whichever we're doing now? If this is a bigger case, have we got the incisal edge of those centrals exactly where we want it? Do we have a record of that? Do we know where we want that incisal edge? Because we're going to base the whole cosmetic case on the placement of the incisal edges. Sometimes that's a whole program to teach on its own. A horizontal stick bite, we all know what that is now, but a few years ago, I was teaching that and saying, please give me a horizontal stick bite with this case. And actually, 2 days ago, I got a call that said, I just sent this big case in, do you have everything you need? And I look and, it looks like there's everything I need. And then I go, whoa, no, wait. I don't have a midline marking, and I don't have a horizontal stick bite. And they're like, what's a stick bite? Oh man, back to square one. So that's a really good one to teach on. And I'll go over that in just a minute. We'll talk about what that is. So marking the midline is a big one, and the due dates all the way through. If you've got a case like these all-on-4 cases, the temporary, we have due dates all along the way. We need to know what those are. And if they're not spelled out exactly, sometimes it's good to just call and make sure. Okay, it says this one is due on this day, and this next step is due on this day, and make sure that you're on the same page as that front desk girl, because it's terrible now to miss any kind of a due date. We never want that to happen. You'll always stay ahead of your due dates. And another one to teach on is a diagnostic wax-up. And all of these things I've talked to you about come through communication. So I'm going to start by saying I really want the doctor's cell phone. So you're going to ask for this at some point, because it has so much to do with communication. So I'll tell you what I see happening in my lab. We'll get the case in, do the model work, and then a guy that trims the dies will check the bite, make sure that if it's a kind of a screwy bite, then we always ask our doctor office to please take a blue moose or a secondary bite. Now, most everything we get is in a triple tray, and usually that bite is great. And when I say that, I'm talking the 80-20 rule. 80% of the time that bite is great. 20% of the time that patient is biting somewhere else, mostly in protrusive, but somewhere else, and the doctor doesn't really notice and nobody notices, and they'll just send that to you. But I ask, if it's a kind of a screwy bite, if it's different, if it's out of the ordinary, please take a blue moose bite with that triple tray. Now if there's so we'll look at it and say, oh, that's a little different. Is there something to check that with? Well, hopefully now there's a blue moose, so we take that and put in and say, oh, yep, that's exactly what's going on. That's right where they bite. Or you put that in and go, whoa, the model man missed that. So you send it back and have it remounted with the bite. Now it's with the exact right bite. Great. Open that up and check and see what the clearance is. Now, here's a little thing that we use in client retention, and this is how you keep doctors sending work back to you. I want you to take this now and equilibrate it. So you're gonna use, we use some red silk and we go tap, tap. Just grind off the little red dots. You're not grinding teeth. You're just, on those little red dots, you're grinding, just grind that off. If they're hitting on a bubble or a bleb or a mess up or something messy that was in that impression, clear that. Look at it now, you've still got some clearance. A minimum of twice. Tap, tap the whole model, and just on the working model, don't do this on the opposing. Look on the opposing and make sure it's not hitting on a bubble. But on your working model now, grind again. Because when a patient bites down, teeth give a little bit. On a stone model, they do not. So clear that, it'll really help in the occlusion. Now, check your occlusal room. If you don't have occlusal room enough for this restoration, it's not because you equilibrated. That's the way it'll be in the mouth. Now, you need for your solid zirconia crown to be at least 8/10, and the latest that they're talking about is a full millimeter thick. You look and you don't have that kind of room. You should have about 1.2 for that solid zirconia crown by the time you get your virtual die spacer in there and room occlusally so you're not crashing into it. So I'll take a picture of that closed articulator and I'll send that in a very close up so the doctor can see. I'll send that to his cell phone and I'll say, plunging cusp, looks like the opposing could be trimmed a little bit, or it looks like we cannot trim the opposing, that it looks like a worn out crown as it is, but maybe we could trim the prep. Or, you know, and then the doctor might write back and say, hey, yeah, take that off the prep, it's a root canal tooth, I just left it high, sorry. Whatever that is, the main thing we just did was communicate. And he's going to get the chance to say which one he wants to take that from. And that leaves the doctor in control, which really left us in control. Because now we're not giving him a crown that's going to fracture in a couple of months because there was no room. So that's why we want the cell phone. We can use it for a lot of other things, mostly close-up pictures and communicating. I do the same thing with the margin. If a margin is not exactly easy to follow, easy to see, and it's a doctor who will say, hey, I was seating this crown and I felt a little click. If he's going to be looking for a little click, then you have to be looking for 100% perfect margin, because if you don't have that in the impression, he is going to feel a little click. He needs to know why. A horizontal stick bite, I'm going to quickly go through that with you. You have the patient stand, and hopefully, I haven't not drawn straight lines here, but in front of blinds or bricks, have a background with some horizontal lines. That really helps. And just take like the 6-inch Q-tip and a little bit of fast setting impression material and put the impression material on their lower lip and set the Q-tip right in the impression material on their lower lip. Get their head straight with the floor, their pupils straight with the floor and with the horizontal lines, so their head is straight. and then set that Q-tip in there and straighten that out till it's straight. Now it sets up and they're biting into it a little bit too, so you can set it on their lower teeth, bite down and it's on their lip. Now it's set up, you can take that and put it on their model in an articulator and orient that with the bench top till it's flat. There, mount that in the articulator. Now your whole case is horizontal according to the way their mouth is and their head is. That gives you an exact face bow, not placement in the articulator, but a horizontal set. And it's the most accurate face bow that I've found, and it works on every articulator. So you just orient that, set it on wet plaster, and keep it exactly horizontal with the desktop. You've got your bite. And more than once, more than a few times, I've seen cases and I've produced cases that were off a little bit horizontally because we did not have that stick bite. So ask for it and teach how to do it. I have more about this on my website, but I believe that it's pretty common knowledge now. Even as much as 5 years ago, it wasn't, and even in a few offices now, we need to teach it. So a horizontal stick bite can be the whole item, the whole subject of your lunch and learn. So a diagnostic wax-up is one of the main things that is communication. And this helps the doctor see what is possible. The lab goes through all of the steps, so the lab now is very familiar with the case and knows what is possible and what they can do. And you talk about it. Are you going to do some tissue reduction or some tissue modeling to get that even? And if you're not, if that doesn't matter in this case because the patient will never show tissue or for some other reason, then you get to see where the incisal edge is set, how long these teeth are, what the overjet is, where the midline is, what style of teeth they like. The doctor gets to present this to the patient, and now the patient sees, oh, okay, I love that, and usually they do because it's beautiful and natural and it gives them all their teeth back and they're all shaped to golden proportions. You know, a wax-up is like magic. Sometimes they'll say, oh, could you change this or this, or I really wanted them all the same length and wear the laterals shorter. You know, you get stuff like that, but that's good to know. So change it a little bit, and now, you know, they get their temporaries made from that wax-up. We're all on the same page, and I think most labs do great diagnostic wax-ups these days, so I don't have to go into that, but know that that is a great subject for a lunch and learn. And you probably don't have time to throw all of these things into one. So I've given you a whole bunch of stuff here that is very valuable for a lunch and learn.